Hello everyone and welcome to the live feed for the first time. I've been getting a lot of questions in the comment sections and I thought perhaps it's best to go live and answer some of the questions. A lot of questions are very intelligent and actually I do appreciate asking so many questions, and there have been some repetitions in some of the questions. Therefore, I'm gonna go through the ones which are being repeated and help you address some of your concerns. I'll be starting off with one of the questions which has been repeated a few times, and recently it was asked by one of our doctor colleagues that is related to the usage of drugs like Manjaro or Ozempic, which is being actually used by counting the clicks to reduce your cost. And one of the questions asked was that, okay, if we are buying Manjaro 15 milligrams pen and we're doing click counts by 10 clicks and getting 2.5 milligrams from that, so what's the view on having a smaller volume? Because if you understand it properly, the 15 milligram pen device is supposed to give you 4 dosages of 15 milligrams. And if you're going to take at least 2.5 milligrams each time by counting the clicks, it means that you would have this pen device lasting for 6 months. So two questions are repeatedly being asked that, okay, what's the validity of the molecule at 6 months of usage? A valid point. And what about the volume? Because normally if you're getting a fair amount of volume to get the 15 milligrams, and the same volume is used if you're getting 2.5 milligram dose in a different pen device, then if you're getting it from the 15 milligram pen device, the volume is extremely small. It may be just a few drops to get you to have the 2.5 milligram dose. Is that going to be effective or not? Now, in order to answer the first point, that what about using this pen device for longer than the labeled timing, which is usually 6 weeks, 4 weeks for majority of protein molecules. But the box says that you can use it for 6 weeks. After that, you can discard it. This has been in practice since the COVID times, as we had the shortages, and basically Ozempic, which was not available, it was being used by clicking and click counting mechanism to actually be used for longer than this period of time which is written on the box, and it has been effective. The main rationale behind discarding or discontinuing the molecule or the drug is the protein gets denatured, and denaturing of the protein molecule means the efficacy would be lost. So for it has not been a safety concern that something poisonous is being injected, but the efficacy of the molecule is being lost. So as long as you're having a supervision with your endocrinologist and you are aware that the efficacy of the molecule has not been lost, you can carry on using, provided the cold chain, which means the storage requirements are being met. I do appreciate that if you are using the same pen device for a very long extended period of time, it might lose efficacy and you may not have the exact storage requirements. So as long as your endocrinologist is happy, you're happy with the response, you're feeling okay, that should be overall okay to carry on using like the way you are by the click counting, and it can be used for longer than a month, the same pen device. Now, the other point with regards to the volume being very less and only a few drops giving you 2.5 milligram dose from the Manjaro 15 milligram pen device is quite a valid point. But I'm not sure whether you are aware of this phenomenon or this kind of formulation or preparation in other protein molecules. For example, insulin. One of the insulin, which is glargine, and used to come by the name of Lantus, used to have, for example, this much volume in one of the pen devices, and the same glargine was then provided in a concentrated form that 1/3 of the volume would provide you with the same units, meaning the solution was concentrated and came with the name of Toujeo. So in medicine, we have used this practice by utilizing a concentrated form of solution. Again, Tresiba insulin has got again U100 and U200 strengths. It means that you can actually make a solution of protein molecules which is much more concentrated and have the same efficacy. And in fairness, the efficacy of the concentrated forms of insulins is better as opposed to the diluted forms when we look at their results. I wouldn't be surprised that the concentrated form of solution for tirzepatide, which is Manjaro, which is the 15 milligram, might be better as opposed to the diluted form, although I couldn't find any evidence around that. However, it does make me comfortable using the concentrated form of solution because you're getting less volume injected in your body to get the same strength of the same dose of the molecule, and in practice I have seen the efficacy has been absolutely fine. It has not been ineffective, or it has not been something causing any problem. In fairness, if someone is getting the injection site reactions, or someone is getting lumps or bumps at the site of injection, having a smaller molecule, smaller volume is better as opposed to having a bigger volume. Therefore, from click count perspective, I personally have seen great response in terms of patients being able to utilize the same pen device for longer periods of time without losing their efficacy, without having any major kind of side effects. So from that perspective, I would provide reassurance and actually encourage, if you are paying from the pocket, you can actually save a lot of cost by doing the click counts. There's another question from Pat Sebastian with regards to that he has been using the 5 milligram dose and would like to go down on the 2.5 milligram dose, and was asking that how should we taper it down. Now, I'm a huge fan of supporting the minimum effective dose, because you have to realize that these medications might be utilized for life, because these conditions, whether you're talking about diabetes or you're talking about obesity, they're chronic conditions. They're not going to go away. There's no cure behind them. So if you are using these medications for either diabetes, or you're using them for obesity, whether it is Manjaro, whether it is Ozempic, whether it is Wegovy, they're excellent molecules, and they may help you put your diabetes in remission, at the same time control your weight. But when you discontinue, the conditions do come back. This means that if you are planning to use something for a long period of time, extended period of time, and sometimes for life, unfortunately, because these are chronic conditions, so you need to have a strategy that you are going to use the minimum effective dose. And there are two major advantages there. When you're using them at the minimum effective dose, you are actually not only preventing your body from developing the tolerance, but at the same time, you're making sure that you have a cost saving. And if the efficacy is lost, then you always have room to go on a higher dose. Nowadays, I'm seeing a lot of problem that people have been using a very high dose of these molecules for an extended period of time, because they had a rapid escalation of the dose, and the efficacy has not been the same, or it has been lost, or they're regaining weight, which is one of the big problems. And the efficacy after the 15 milligram Manjaro, if it is lost, you cannot do anything more. Similarly, if you are losing the efficacy on the full dose of Wegovy, you have to take a discontinuation and a break, and you have to restart after a break, because your receptors are downregulated. So try to maintain the minimum effective dose if you can. There's another comment with regards to the usage of different strengths of pen devices. For example, you do have different strengths of Manjaro. Sometimes people are buying from their pockets, and they may not be able to get hold of the correct strength device. We have got 2.5, we've got 5 milligrams, we have got the 7.5, the 12.5 milligrams, 10 and 15 milligram pen devices. So whichever strength is available, you can actually do the click count from that particular pen device to get the appropriate dose for yourself. The most important thing to remember is that the dose calculation and what should be your starting dose should be done under supervision of your endocrinologist. And I would highly recommend that you always start with the minimum effective dose. Please do not jump up on the dose. Sometimes people are just starting at a higher dose from the beginning, which is not the correct advice. Moreover, if you start high, then you are putting yourself at risk of developing the tolerance, and also the same kind of problem that you might reach the full dose, and eventually you may not be able to down escalate or reduce your dose in the long run. We don't want to develop the intolerance to these molecules, which does happen. And like any chronic illness, you have to be sure that you have a long-term strategy. You do not want to be starting these for a short-term quick fix, as some people might be thinking that they can use it for a couple of months and then just discontinue it altogether. Believe me, the weight regain is almost eventually happening for every individual. Specifically, I'm talking about people who have been struggling with their weight despite having a very good lifestyle, because actually your bodies are very good in understanding that your weight has to stay at a certain level. For example, if your weight or BMI is around kind of 23 and you're already active, that's fine. But if you're active, eating clean, and you're having a BMI around 27 or 29, it means your metabolic set point has been disrupted. And this means that your internal mechanism to keep your weight at that level has been disrupted to the extent that it will always bring you back to the same 27, 28 BMI no matter what you do. So if you're going to try to bring your weight down by using some of these medications, eventually when you discontinue them, your body will gradually and slowly bring you back to the same point where you used to be. It will not happen overnight, but it can happen over an extended period of time. So having a strategy to make sure that you're using these medications for a long term, but at the minimum effective dose is mandatory here. Moreover, do not consider these medications as being a magic tool like a magic wand, because you are well aware that as you get some efficacy from whether it is Ozempic or Mounjaro or Wegovy, these are GLP-1 receptor agonist molecules. They do an excellent job in controlling the sugars. They do an excellent job in getting your weight down, but you're only utilizing one mechanism. And we have to be aware that we must be utilizing additional mechanisms on top of that. And the additional mechanisms can be anything like you are adding something as an insulin sensitizer, you may be adding something to help you kind of get rid of extra calories from the body. And not to ignore the fact that the most important thing that we are able to do ourselves is improving our lifestyles in terms of eating habits and also doing some activity. Now remember that people sometimes lack the motivation to do the exercise, or they struggle to change their eating habits, and that's because their body's metabolic set point has been set to a level where there's a lot of inflammation going on, there's no motivation, and this is the trouble that they are facing, that because of their current BMI, they cannot do exercise, whether they are fatigued, whether they lack the motivation, or they are actually having too many cravings for sugars and carbohydrates. Another thing to realize is that once you lose weight, you will find it easier to exercise. You will find it easier to actually make those eating habits that were always a struggle. So take this as an opportunity. Whenever you're on these medications, this is the time to make a change. If you don't utilize this effectively to make those important changes in your lifestyle, both in terms of eating habits and the activity, then it's actually a failure, because we are kind of missing out that great opportunity. And in terms of eating habits, we all have GLPs in our body, and they can be stimulated very easily from the intestines by actually following the correct pattern of eating habits. Make sure you add fiber first in your diet, then add the protein, and then add the carbohydrates at the end. Keep your carbs at the end, and this will help stimulate your GLP, which is the glucagon-like peptide, to help you get this GLP response from your body. Remember, it's a long-term strategy, and if we do not have a long-term strategy, it will always be a yo-yo. You can lose weight, you can put your diabetes in remission, and it always comes back. The medications like Mounjaro, Ozempic, or Wegovy, they are highly effective in controlling your sugars, so diabetes invariably goes in remission. Another problem that I have been facing with the insurance and the healthcare providers is that as we use these drugs, the diabetes goes in remission, and you do see the HbA1c dropping down from whatever it used to be to a completely normal level. And then eventually, as it normalizes, if you discontinue the drug and then at some point your weight goes up and you want to restart it, it becomes extremely difficult to get another approval from the insurance provider. So make sure your first HbA1c, which is the 3-monthly average sugar test, if it ever came in a range for diabetes, keep that safe with yourself, because it would always be extremely helpful to go back and reflect on that test report and try to utilize that to get the approvals of these drugs from your insurance providers, because they would always go back and want to see what was your HbA1c in the beginning, whether it was 3 or 4 years ago, as this record keeping would help not only you but also your healthcare providers to get these drugs from the insurances and help you in continuity of these drugs without putting too much pressure or burden on your pockets there. I'm just going back to a few other comments, and feel free to add or drop any comments or questions if you have in your mind while we are on the live feed. Mostly the questions are coming with regards to the confusions around the counting of clicks and whether it is a safe or effective way. I want to reiterate the same message, that this has been tested during the COVID times. It has been utilized in clinical practices. We have seen that being an effective means of providing a drug which is otherwise quite costly. It is a great medication for the treatment of diabetes, as well as obesity. Unfortunately, because of the difficulties in terms of getting the approvals for obesity, we do initiate that for diabetes patients quite easily. But again, as a fourth line, you need to be on a few other medications before it comes as your drug of choice for diabetes. For obesity purposes, so far the licensing is there, but the healthcare providers are always struggling because the insurances are not covering obesity as a chronic condition, which is a shame because obesity, as per the WHO guidelines, does follow into the domain of a chronic illness. We never ask you about your old or acute illnesses, which may be like a headache or a flu, because they are cured properly with antibiotics and painkillers or whatever, because the acute illness always has a cure, but a chronic illness is always having a long-standing relapsing remitting course. That's why whenever I'm taking the history from my patients, these questions are always asked: did you ever have any diabetes in the past, any cholesterol problem, did you ever have thyroid issues? So these are chronic illnesses. The difference between acute and chronic illness is acute illness has a cure, but the chronic illness doesn't have a cure. It actually keeps coming back. Obesity is a chronic illness as per the definition because number one, it keeps coming back. Number two, it does cause end organ problems. Even if you control it, there's no cure. It's always a control for all the chronic illnesses. You control it. If you discontinue the discipline in terms of lifestyle, the medication, it almost always comes back. In terms of lifestyle, one more point, that activity that we advise our patients for obesity or diabetes is not high intensity interval intermittent training. It is actually something called mid-moderate intensity activity, and it is quite simple. It is something that has to be incorporated in your life forever. You need to enjoy that. There are two things that have to be there. One of them is actually something that brings your heart rate close to 110. For high intensity training, usually in the whole week, you need 75 minutes. But for the moderate intensity, you need 150 minutes over the span of 1 week. And this can be split as 30 minutes daily. You can have 30 minutes of activity, moderate intensity, 5 days a week. You do not need to do any strenuous training like treadmill or you're running around. You can do anything that brings your heart rate close to 110 and try to maintain that around it. You can split your 30 minutes into different sections. You can actually kind of go on a flight of stairs if you do have an access to a few floors, and make sure your joints are okay to go on that. If you're working on a high-rise building, rather than using a lift, going on 3 or 4 flights of stairs would actually give you that heart rate that's required to keep you going. Make sure you don't have any cardiac health problems. If you are doing that and your joints are okay, you don't have to run upstairs. It's just going on 3 or 4 flights of stairs on 3rd or 4th floor. You will see that heart rate go up, and if you're doing it twice or thrice, you're actually ticking that box of moderate intensity activity. Then we all have, a lot of screen time, sitting on extended periods of time on the laptops or desktops for 8 or 9 hours. Very busy in our schedules. The rule of 30 comes here. The rule of 30 means that every 30 minutes you have a 30-second break, and that 30-second break can be on the table without moving from your console or your laptop, and that is to make sure the circulation in the legs and rest of the body is happening. You can just do a simple stretch, kind of you're stretching around for 30 seconds, or you can just kind of do sit and stand at the same place 30 seconds. If you do that for 30 seconds every 30 minutes, you're actually getting around 15 minutes of break to get the circulation around. You can use trackers on your smart watches, or just set an alarm that you are actually utilizing your time effectively. And nobody should have an excuse that they cannot have a 30-second break every 30 minutes. So I'm trying to give you simple tips and kind of simple prompts that you keep going. You make sure you make those changes which are more sustainable, not affecting your routine, not affecting your daily lifestyle. We are all busy, and it is not something that is becoming a hurdle that, okay, you have to go to the gym and start doing some stuff. So whatever minimum you do, that's absolutely fine. Not to forget the FPC protein, fiber, protein, and carbohydrate sequence in your eating. It's highly effective. I've seen this while people have been wearing sensor. They have flat sugar profile. The fat doesn't attach to their body. It stimulates a lot of GLP response from your body. Fiber can be anything. Keep it simple. Keep it easy for yourself. It's a bowl of salad. Don't cheat with yourself. You can have cucumbers, carrots, lettuce, whatever you like, olives as well. and add some protein. So the first item when you're starting any meal has to be fiber, which is a bowl of salad, and then comes the protein, which can be egg white, it can be chicken breast, Greek yogurt, even protein bread if it's available, or a protein bar if you want. And then the carbs come at the end. If you follow this sequence of food items, it actually helps stimulate the GLP response from your intestines, and this will be ensuring that even if you're using these drugs, the efficacy is much, much better. The fact that we already have GLP in our body, we need to make sure that we don't rely on these medicines like they are the magic pills or magic wands. We make sure our body's physiology is being used. And I have seen this FPC protein, fiber, protein, and carb pattern work very well for ladies with gestational diabetes on the sensors of glucose that they're using. And they have got flat glucose lines, and people melt away their own fat on the long run. And the final thing that I would like to say, that whatever you do in terms of lifestyle changes, sometimes the opportunities are not happening because you're carrying a lot of weight, you're feeling very tired, fatigue, lack of motivation. But when you do go on these drugs, the motivation comes up, you do feel better, you do feel lighter. So take that as an opportunity to make sure that you make the best for yourself. That's all for today, and thank you for joining in. If you have any comments, please do add them in the comments below. I'll make sure that I do try to address them. Thank you. Bye.